Hi, this is Dr. Sterling here at UAMS Aesthetics. We've talked a lot about facial rejuvenation, and I just wanted to round out that conversation with a discussion of the base of the pyramid, the foundation, which is typically skincare. My approach to skincare with patients is first determining what are they currently doing and what their goals are. On physical exam, I look at certain things like wrinkles, total amount of sun damage, discolorations on the skin, dryness versus oiliness, etc. For my standard patient who has potentially moderate to significant amounts of sun damage, so more significant or obvious wrinkles and discolorations of the skin, we might be talking about some more advanced corrective treatment options, which would be potentially like a retinol or a tretinoin, something in that line of a family. And for the coloration, something like a hydroquinone or other agents that might help even out the skin color. Of course, with more advanced regimens, there are some drawbacks, and ultimately that will be the degree of sensitivity after the treatment, so the amount of flakiness or redness, irritation that the patient might get. But the long-term benefit might be significant improvement in some of these issues. For patients who don't have much damage to their skin, we might be talking about more so preventative and maintenance things like sunscreen, moisturizers, cleansers, toners, exfoliators, just to even out that top layer of skin and then help protect them from further damage down the road, which is usually for most patients sun damage. For my patients who are getting facelifts or other type of facial rejuvenation procedures, I usually like to pre-treat them with a more advanced skincare regimen like a retinol, tretinoin, something to really rejuvenate the skin and get us ready for that surgery. And the other thing to consider is what type of skincare regimen the patient can use long term, and that's a huge and important consideration. You might want to start it, but then a lot of people, they can't maintain it and they don't do it long term, and then if that's the case, they don't end up getting any of the benefit from a skincare regimen. So for those patients, I think a really good option is something like a chemical peel, either monthly, quarterly, or annually. At my office, we have a variety of different chemical peel options, from more mild ones that might just help take off the top layer of skin or provide more of like a chemical exfoliant. And then we have deeper types of peels that actually will resurface the top layer of the skin. Of course, with the more advanced ones, there is a longer downtime to it, but there is more benefit in terms of coloration and wrinkles. For that intermediate level peel, the 3-step peel I use from ZO, it's really interesting because it helps with that degree of chemical exfoliation and then gives really large doses of retinol. So I already mentioned that previously, that retinol can be a very useful agent to help improve and erase some of the issues that we see with sun damage, such as wrinkles or discolorations. But if you can't maintain these long-term low-dose retinol therapies, for some people it might be beneficial to just pulse it every now and then with higher and stronger doses of retinol for a very short period of time, maybe just a few days, and that's something that they can maintain versus the alternative. So that was just a little bit of a deep dive into skincare. There's really a lot that we can talk about. These are just some of the highlights and things that I find to be important. If you have any other questions, feel free to reach out on social media, give us a phone call, send us an email. Thanks and have a great day.